related to fatigue. So as time goes on, when we are done with this, I'll come and show you how to use NANDA to write your nursing diagnosis. But it is better you understand it like this than say you are going to use it, because during exam time or NMC, you are not going to use the NANDA. You need to use your brains. So you need to understand the patient problems, then you need to know how to write it. So pain, so when you come here, when there is pain in the nursing care plan or patient complains of pain, the pain can be what? Can be acute or chronic. So that's the only thing we have in writing the nursing diagnosis. So nursing diagnosis, when it comes to pain, is either acute or chronic. So now let's continue. So we've seen we are done with what? With the nursing diagnosis. So this is the nursing diagnosis. So when you come here, we have the objectives or the outcome criteria. So when we talk of the objective or the outcome criteria now, that one here is where we are going to indicate, say, treatment now with my patients, within this hour or this next hour, the patient will be free from this condition, or the patient the pains will reduce, and I said this one will go down, or that. And then from the outcome criteria. So treatment now, the my patient, be able to take this period and sign the panel, and I say within 1 hour, the patient is going to be okay. So that one too will give you only 1 mark. NTN outcome criteria. And you see, patient will experience comfort within the next 1 hour, as evidenced by, and you say, how you comprehend as a patient has what chest pain. And I mean, about outcome criteria, and I see the patient will experience the comfort within the next 1 hour, as evidenced by patient verbalizing absence of chest pain. And this one is being what evidenced by what the patient in a catcher say pains in I reduce it. So that place you need to write 2. So it is what the patient and the nurse observing the patient. Use how you need to write 2 the outcome criteria. Use the patient will experience comfort within the next 1 hour, as evidenced by 1 the patient verbalizing absence of the chest pain. Then the 2 the nurse observing red lights, facial expression, and a cheerful behavior. So I'm going to make sure the nurse not observing who's the patient and I've been the facial expression, I'll be cheerful and all those stuff. So I'm going to make sure. So within 1 hour, the patient is going to what? Do this or going to show the signs. Then next come here. Here too, we talk about what? The shortness of breath. Then the patient will regain normal breathing pattern within 2 hours, as evidenced by patient breathing normally. As evidenced by the patient now start here then breathing in a normal or started breathing normal and kakra. Then here's was it the nurse recording normal breathing rate and sound. Do you see when somebody comes to the world with asthma and all those stuff now, we have you draw a chart be manipano say nipa and follow that chart. So yes, say how I manage patient and you see the nurse check the patient in no respiration within that 1 hour that will get to know sort as yes at the end reduce it. So due to that they can give hours. So I'm gonna make sure. Yes. So now let's come to the sleeping pattern disturbances. That's related to the persistent cough. You will see here now, the patient cough will be subsidized within 2 hours, as evidenced by patient verbalizing cough has reduced. Here now, you need to be back with evidence. Yes, the patient and the cough will be reduced. So as evidenced by the patient in the air cassette, 1 hour as I reduce it. Then the second one is the nurse observing the patient's cough. So then the last one is the activity intolerance related to fatigue. It was the patient will regain strength within 4 hours, as evidenced by patient verbalizing the reduction in fatigue or reduction or reduce of fatigue. So I'm gonna make sure the patient can't say they fatigue now then abafum. So then was say nurse observing recording patient will be what? Back from what? Fatigue. The nurse now observing now the patient, the fatigue in a patient will go down. Will also what? Let you know that within this hour the patient is will be out from the fatigue. So guys, now we know what the nursing diagnosis, we know what the objective the outcome criteria, and also guys don't also forget whatever you are going to do here, you write the what, the date and the time. The date and the time. Because most students make their mistakes. So don't leave any space and answer in Jabba one throw. Make sure say all the spaces are being written. Or so now let's move to the nursing orders. So when we talk of the nursing orders, what the orders are actually the things that they have what? They have assigned you the nurse to do, or the doctor has assigned the nurse to do. The nursing orders needs to be straightforward. It needs to be straightforward. The first one we say provide quiet environment. So that place you need to write what? You need to write 4. You can write 4 or 3. It depends. But make sure say the nursing intervention the over 4. Yes, so let's go on. So I say the first one was say provide quiet environment. Then 2, I say ensure bed rest. 3, I say check vital signs. Then 4, serve prescribe analgesics. When we talk of analgesics, they are pain drugs. They are drugs that are being given to patients to relieve them from what? From pain or trauma. So I want to make sure. So these are the nursing orders. The things that you order the nurse need to do for the patient. That are what the nursing orders. So I want to make sure. Yes. So when you come here, what? Provide quiet environment. So I want to make sure. So when you come here, you need to make sure bed rest was what was ensured for patients, and the bed head was raised, which is what? A simple unoccupied bed. And television and radio was switched off to ensure quiet environment. So to make catch provide quiet environment. The TV now has someone in Yemen will be quiet. So what provide a quiet environment? By turning off the TV and the radio. So I want to make sure. So here to the other train and sending the one meeting a corresponding. I want to make sure you need to correspond. Then when you come here, I say check vital signs. Vital signs was checked, especially SpO2 in every 30 minutes. So you see, say when the patient has problem with it, or the asthma patient, meaning the SpO2 near them. So due to that, you need to check the SpO2 every 30 minutes to know whether it's dropping and now say then. So I want to make sure. Yes. So now, Messiah serve the prescribed analgesics. Remember, I say the IV morphine, 10 milligram was served for the patient to reduce the pain. So then when we come here, the second one was say ensure proper ventilation. The also nursing order. Then when we come under, we say encourage patients to take in more copious fluid. Then when we come here, we say monitor the ABGs. Then ensure bed rest. So the same one I had the same one I had the bed. So all those under the comment section, I want you all to write 5 nursing orders. Then you write 5 nursing intervention. In the next episode, I will make sure I will read everything out for all of us to also read and understand everything. So now let's move to the evaluation. So when we talk of the evaluation is talking about on the outcome criteria and I said the objective, how far did it go? How did you achieve that thing? How did you achieve it? Were you able to achieve it or not? So if you were able to achieve it, or say then go fully met. Go fully met. As patient verbalizing chest pain has been reduced. Meaning say you were able to achieve your goal. Say patient near the pain near the chest pain near it reduce here. Because what say time and say within 2 hours, within 1 hour, and 1 hour so you know, were you able to achieve the goal? So you were able to achieve it. The goal fully met. As patient verbalizing that the chest pain has reduced. You have achieved it. So then you indicate, you write the date. It will be date so you write the date. Then you sign. It will be signed with signature L1. Then after that you indicate the time. So when you are done signing, you indicate the time. Then you indicate student nurse. Now what travel initials? Maybe they are amo AJ Kelvin. Maybe they are amo AJ Kelvin. Maybe they are me sign you. Maybe try date me. Me sign you. Me try time you. Then I will indicate student nurse. Student nurse. Oh, student 2 round me and then student nurse. So what I say? Student nurse via AAK. Intimidating then I'm more AJ Kelvin to me and then student nurse AAK. That's my initials. That's the patron say. Then also I say if you are not able or the time span now 30, and hours now 30, who do want me achieve here? You need to also indicate say go partially met. Go partially means want me achieve fully going now. So go partially met. As evidenced by patients still complaints of what maybe the pain. So this is how the nursing care plan goes. This is how the nursing care plan goes. So if you want a full nursing care plan which has been written and you want to go through you can say hi and I say the number by 2 screen also my WhatsApp number. You can take it, then chat me and I say you say hi under the comment section and I say drop your number there. We will pick it, then we will send it to you. Or if you want a further inquiry, we will continue. Then when you come here, we have what? The medical orders. So when we talk of the medical orders now, we are talking about. So these are the medication being given to the person. The only medication, the other treatment, the investigation. To so you see, say Nipano, you're doing man on what? On the 12th of what? Of April 2025. And I'm trying to so the medication being given, and the IV what aminophylline, and I'm say 200 what milligram. Now I say start. But mistake I say because I check care plan nipa bebre on checking medication we no immediately when start meaning say adro no okoje ba ya fama nipa no start the actual no so into me try start now had better say date completed me try say it was being completed on the same date because adro no start there that day na on make sure no. Then when you come here we also talk about the cough measure 10 milligram TID times 7 days. Do not TID chest 3 times daily. Do one say times 7 days, meaning the end Saturday now. So you need to also what indicate and sign into better not yet. Not yet. So yes. Then when you come here, tap PMOS and I'm TID times 3 days. So so that one also not yet inside, meaning saying inside. Then we have the IV normal saline 500 milligram, and only your buy and you indicate. So that one because you have my indication you can write what I say asana say inside. But when you say IV normal saline, you be do the basic so you see, so you need to what? You need to know how obey on your. Then when we come to the other treatment now, you see, say, I was talking about a patient with acute bronchial asthma. So definitely, other treatment oxygen therapy. So you need to also indicate say oxygen therapy maybe 2.5 within every 30 minutes. Say other treatment be now we're indicating. If no other treatment was done for the patient, then no other treatment was done for the patient. Simple. And what treatment be a manner. Just right, no other treatment was done for the patient. Then, when you come here, investigations. So, if there were some investigation, we are more able to say then the FBC, the FBS, then blood for malaria, parasite, and all those stuff. If they were also being done, then you state the date here. Then the diagnosis, the investigation or the test. Now, then the results are a buy. Then you write it here. So, guys, this is how the nursing care plan goes. So in our next episode or in the next video, I'll be talking to you guys about how to use NANDA to write our nursing diagnosis. Because one problem I know is we all students have we have problem when it comes to the nursing diagnosis. So this one needs to relate with this one. Then the nursing diagnosis needs to what? Corroborate, the patient problem needs to corroborate with what the nurse or needs to what correspond with the nursing diagnosis. Thank you guys for watching. Keep on watching Nurse Kelvin TV. We have amazing videos coming to you or coming for you or coming on this platform. We are going to help you to achieve your nursing success. God bless you all. Thank you.